of today's class is HOS test and EOSIN and NIGROSIN test. So we are basically dealing with two tests today. So this tests are specialized only for sperm to check sperm vitality. Okay. So when we proceed with the class, you'll get to know what it is, how it is done. Okay. And this test are known as sperm function assays. Okay. So we will get to know what is sperm function assays. So it is used to determine if the sperm have the biological capacity to perform the tasks necessary to reach and fertilize ova and ultimately result in live births. So as we know that it is very important for the sperm that it should be like viable enough and like it should be live and it should be morphologically good also and it should be viable also. Okay, so how to know that? To know that thing, we have to do some sperm function assays. So out of these two tests, today's topic, what it is. So these two tests are out of them only. So why these tests are needed? This test detect function of a certain part of spermatozoa and give insight on the events in fertilization of the oocyte. Okay. The basic semen analysis has limited predictive value for pregnancy in couples trying to achieve natural conception and in couples undergoing advanced assisted reproductive technologies. So basically, one question would be coming like semen analysis, isn't it enough? Like we do it on a routine base, right? In every lab. As soon as a couple enters a fertility clinic, we prescribe some basic test, and in that basic test for male, the semen analysis comes, right? So out of that, why leaving that semen analysis? Why it is not enough? So why it is not enough is like it can't give like all the things required. Okay, it is only telling us only specific things. It is not telling about the vitality, how it is, how the sperm will perform from inside. Okay, that we don't know. The functional capacity, okay, we don't know that by semen analysis. So we need this kind of tests. So what is the importance? Because an intact DNA is requisite for giving a viable pregnancy. That's why it is very important that the sperm should be like morphologically well, functionally well, so that only it can deliver a intact DNA into the oocyte and form a euploid embryo. That is like a normal embryo could be formed. So in the era of assisted reproductive technologies, the evaluation of semen and the functional capacity of its main cellular components, spermatozoa, has become quite detailed. So you all know that it has become quite detailed these days. So I have basically divided it into two parts, like routine and non-routine. So routine, you know, all of you know that routine is the main that semen analysis, what we do to check the volume, color, pH, viscosity, liquefaction, concentration, motility, all this comes into the routine semen analysis. The cornerstone of the evaluation of male fertility is the semen analysis. However, it has some limitation. Okay. So non-routine tests are this test. Okay. Out of this HOS test, which we are going to discuss, is out of one of them. So moving on to for HOS test, before going to the HOS test, I want you people to know that what is sperm membrane integrity. Okay, because this two tests which we are going to discuss, this is basically depending on the same membrane integrity of the sperm. Okay, so sperm membrane integrity, structural and functional, when questionable or inadequate, may compromise sperm fertilizing capacity by affecting motility, capacitation, acrosome reaction, and binding of sperms on Juna pellucida. So all these things are very much needed and it is attributed to the sperm membrane integrity. Okay, so membrane integrity is evaluated through two tests basically. Okay, so one is the sperm vitality, that is like the structural integrity. So that we will see in the EOSIN NIGROSIN test. Okay, and the other is the HOS test, that is hypoosmotic swelling test, that determines the functional integrity. Okay, so these two are the, one is structural and one is functional. So moving ahead to HOS test, that is hypoosmotic swelling test. So we will see how this method take place. Okay, so what it is? So HOS is nothing but hypoosmotic swelling test is a method to assess sperm viability. As I told you in the starting only that we are going to check the sperm viability by these two tests. Okay, so sperm membrane function plays an important role during the fertilization process and can be evaluated by the HOS test. So HOS test plays an important role in assessing the sperm viability. So coming on to the principle. So any test we do, we should be thorough with the principle, why we are doing, how it is working, and how it is like useful to us. So the principle being, it is based on the principle that viable sperm have intact cell membranes. So we know that sperms has cell membranes, correct? So when we have to see that the particular sperm has intact cell membrane, for that only we are doing this test. So the principle is, if it is intact cell membrane, then when we expose it to hypoosmotic fluid, it will cause water to flow into the viable cells, and we can observe swelling in the cytoplasmic space, and thus resulting into the curling of the sperm tail. Okay, so but non-viable sperms, what will happen in that, because the cell membranes will not be intact in that, and they will not be non-functional, they will be non-functional, so they will not exhibit any effect. Okay, so they cannot, because when we as I told you, in this test we will expose the sperms to hypoosmotic fluid. So when we are exposing them to them, so this, they can't actually, not viable sperms cannot maintain a osmotic gradient, so hence there will be no change in them. Okay, so moving ahead, how it is done. So how we do it? So 0.5 ml of HOS reagent is taken and 50 microliters of liquefied semen is taken. Then it is mixed well. Then we keep it for it in the room temperature for 5 minutes. 37 degrees Celsius for 5 minutes. Then put one drop of like on the glass slide and put cover slip and observe the tail swelling. So we will now see how it is done. What, this is the result part. Okay, so viable, if it is viable, then the swelling of the cytoplasmic space will take place, thus curling of the sperm tail will happen. If it is non-viable, there will be no change. Okay, no change. So the lower reference limit for vitality membrane intact spermatozoa is 54%. So this you all have to keep in mind that for this new sixth edition, it has changed to 54%. Okay, the viability. Earlier, according to 2010 WHO manual, it was 58%. Okay. So coming to examination, as I told you that what will happen. So here examine the sample under microscope at 40x magnification, then evaluate at least 200 sperms and observe sperm tail for curling or swelling or non-curling, or if they are straight. So following sperm curling can be seen. So there are some patterns of the curling which you can observe through this test. So what are those patterns? Tip swelling. Only tip of the tail is swollen, whereas rest of the tail is normal. Then comes the hairpin swelling. Tail swelling is observed at the junction of the main piece and mid piece junction. Swelling of the tip may or may not occur in this sperm. And then comes shortened and thickened tail, short of ring pattern. Okay, partly or completely enveloped sperm tail. So tail balloons due to swelling. So these are the types of swelling which you can observe in different sperms. So this is a schematic representation which I have put. So you can see here in the A, there is no swelling taken place. There is no change. It is, the sperm is straight. It has gone through no change. Okay. Then from B to G, you can see some sorts of swelling has taken place. Here you can see hairpin. Okay. Hairpin like swelling. This is only the tail pin swelling. Okay. Like that only this H-shaped like balloon swelling. It has taken place. Okay. So this all from B to G, you can consider it like a normal or viable sperm, which have shown like, yeah, changes to osmotic gradients. So only we consider it as viable. So this is a microscopic picture representation. Can you make out where the swellings is and how, which are the viable and which are the non-viable? So can one of you tell me that which is a non-viable sperm over here? Class, are you alert?
Yes, ma'am. Yes, ma'am.
Can you please tell me like who is this? Please tell your name and please tell me the answer.
Ma'am, the B labeled is not viable. Two sperms here, B. There's no swelling in the tail, ma'am.
It is straight, right? That is evident. Okay. In this all A marked like swelling is there. Even here also you can see swelling is taken place, right? So they all are the viable sperms. So again, there is one picture where swollen tails are there and this is non-swollen, which is straight. Okay, so result is like reference value for HOS positive is like normal is 54%, equal to 54% or above than that. Okay, that is like a normal value. Equivocal is like 50% and less than 56. Okay, and abnormal is less than 50. If it goes, then it is abnormal. Okay, so what is the advantage of this test? Why we should take this test? Okay, so this is useful when staining of spermatozoa must be avoided when choosing spermatozoa for ICSI. So when we are choosing sperms for ICSI and we want to know those are viable on the table, you say like on the day of procedure, we want to know that which sperm is viable and which is not. Then what we can do is we can do HOS ICSI. Okay, that is a common for some lab they use it like HOS ICSI. So what will they do is like they will just spermatozoa with intact membrane swell within 5 minutes. So it is time effective also, right? So within 5 minutes only you will get the test and you can start with the ICSI. Correct. And as there is no stains, okay, so it is not harmful for the sperm also. So hypoosmotic media does not kill viable sperm, hence can be used for ICSI. So these are all the advantage of HOS test. Moving on to EOSIN and NIGROSIN test. That is our today's second test, which is there for us today in today's topic. So EOSIN NIGROSIN is a staining technique that assess. I hope the HOS test is clear with you people.
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Yeah. So EOSIN NIGROSIN is a staining technique that assesses the vitality of a sperm sample when the initial motility is less than 25%. Okay. So what does the NIGROSIN does and what does the EOSIN does? We will see. So NIGROSIN increases the contrast between the background and the sperm heads, making the sperm easier to visualize. So what does EOSIN does? EOSIN stains only the dead sperm, turning them a dark pink, whereas live sperm appears white. Okay, so this is the principle behind it. We will look into it as we move ahead. This staining technique must be performed immediately after motility is assessed using sperm from the same semen sample. Stain slides can be stored for re-evaluation and quality control purpose. So we can use those stain slides like it is not like you do and throw. You can keep it, store it for re-evaluation and quality control purpose, like you have to just see whether the person who have done it is correct or not. Anytime you can take it and just see the slide again. Okay, so coming to, as I told, this is sperm vitality tests only. So sperm vitality is a reflection of live membrane intact spermatozoa. So it is tested based on the ability of cell membrane to exclude vital stains, that is EOSIN, NIGROSIN dye, from entering the spermatozoa and permeate into the nucleus. So in the previous slide, I have told you people that the viable sperms will not be stained. Okay, so why they are not getting stained? Because they have an intact membrane. So if it is intact membrane, then the dye cannot enter it. It can't enter the membrane and it can't stain the thing. Okay, so this is the main principle behind it. So when physically damaged or broken sperms are there, they will take up the stain. Okay, they they will be easily stained because it is broken membrane, so it will go inside and stain it. Okay, so if membrane is intact, the dye is unable to do so. So vitality thus evaluates viability of cell that is live or unstained dead non-viable stain. Okay, so this is a picture which I have put for your understanding. So the A sperm, what you can see is, it is a, who can tell me what it is?
The live
Live
one.
Yes, that is a viable one because it is not stained. Okay,
Non-stained.
not stained. It is white. You can see it is fully white in color. Okay, and the B one is stained. Okay, so thus it is like easy to differentiate that which is viable and which is non-viable, and why that is happening, that also we are clear, right?
Yes, ma'am.
Okay, so here also this is a microscopic, this is CASA analysis report. Okay, so here you can see dead. It has that CASA has marked it as dead, live. Okay, so you can see the dead sperms are all pink, okay, stained ones, and the live ones are all transparent. Okay, so how it is done? So we will just label all our plasticware and disposable material, then take 10 microliter of undiluted, well mixed liquefied semen we will take, okay? And then 50 microliter of EOSIN, NIGROSIN dye we will add to the microtube, and then we'll mix it up, and then we will take 1 drop of it and put into the slide, and we will wait for 30 seconds, and then after that we will take 1 drop and place 10 microliter of sample and prepare a smear out of it. Okay, so we will let the smear dry first, and then only we can observe it under 100x microscope. Okay, so moving ahead, interpretation. So how the result is done? Okay, so put a drop of oil emulsion on a dry smear and examine smear under microscope with the help of 100x lens. So examine at least 200 sperms and count the following. So we will just count how many live sperms we can see till we reach a 200 count. So easily we can do that, like who are like live sperms which are appearing as white or transparent. So and so that is our viability rate. Okay, so result will be like reference value for live sperms will be like less like more than or equal to 54%. Okay, so it like the viabilities goes the same for both the results. Okay, so I am done with the 2 tests. So it is a short class of 30 minutes. So I think I'm clear to everyone.
Yes, ma'am.
Yes.
Yes,
So
ma'am.
no doubts, right?
Yes, ma'am.
Okay. So if you people have no doubts, then I have some doubts with you people. So I can clear that off, right? We have time, Shweta.
Yes, ma'am. Itishree, ma'am, you can go ahead with your questions, ma'am.
Yeah, so we will do like we will have some question answer round, no? Okay. So
Doctors, please answer for ma'am's question so that it will be an interactive class. Itishree, ma'am, you can go ahead.
yeah. Actually, I'm stuck with this one. I'll just. So here I have participants. So I can see here. So Dr. Abhijit.
Yes, ma'am.
Okay. So can you answer my question for this? Like how you are like clear about the HOS test principle? What is the principle behind it?
Prince-
So so you got the test clear or not?
yes, ma'am.
You got it, but you are unable to say, right? Okay, so let me help you out. So the test, what I have told is it is based on the sperm membrane integrity, right?
Yes, ma'am.
Yeah. So if when we are exposing the sperm to an hypoosmotic gradient, right?
Yes, ma'am.
Oh, okay. So that what is taking place? Okay, let me. So Miss Sonam, can you answer that?
Actually, I was not able. Like this first test was not clear for me.
Okay. So I asked that thing, right? That you people are clear or not? Okay. Okay, no problem. So the thing is, anybody who can make the class or understand
Yes, ma'am.
who is this?
Ma'am, this is Akanksha, ma'am.
Okay, Dr. Akansha, please go ahead.
It means, ma'am, when we put a sperm in a hypoosmotic solution and if the membrane's integrity is there, so it will cause the endosmosis. The fluid will enter inside and cause the swelling of the sperm, ma'am.
Yes, and why that is happening?
Ma'am, because of the concentration, ma'am. The solution that we are putting the sperm in, it is hypoosmotic, and if the okay.
So what it is, because the live, whatever live membrane, viable membrane is there for everyone, like all cell membrane in humans, everybody has a tendency to
absorb the
yes, to absorb
Actively absorb.
yes, the transportation will take place, the osmosis will take place in a viable cell. Okay, that is the basic principle behind it. Like whenever you expose a cell, it will try to gain, it will try to, it will try to just maintain itself in a hypoosmotic gradient. But when the cell membrane is not intact only, then it will show no reaction, correct?
Yes.
So that is what the main principle behind it. Okay, thank you, Dr. Akansha. Then Dr. Shruti.
Yes, ma'am.
Yeah, can you make us understand the sperm EOSIN and NIGROSIN test?
So you are asking particularly for a morphology. See in what you are asking?
No. What is the principle behind it for EOSIN and NIGROSIN test? Like how we discussed HOS test.
Yes.
Yeah.
So, see, usually, mainly it is for understanding the basic and the acidic nature of sperm permeability.
Is it? So the whole class has gone. I have told like starting in the starting of the class, we are dealing with what? These two tests are for what? Checking what?
Sperm vitality.
Viability of the membrane.
Viability.
Yes. So viability, and it depends on what?
Membranes
Cell
integrity.
membrane.
Exactly. sperm membrane integrity. So whole things goes around the sperm membrane integrity for these two tests totally.
Yes.
Okay.
Yes.
Yes.
Yeah. So Mr. Neela Megan. Mr. Neela Megan, are you there? Okay. And Miss Nidhi? Miss Nidhi, are you there?
Yes, ma'am.
Okay. So can you explain that? What is the principle behind?
Yes, ma'am.
Yeah, please go ahead. Nidhi, are you there? If not, then I can help you out with that. Please tell me.
Ma'am, viable cell membrane will not allow the dye to enter. Whereas if a
Yeah.
cell is dead, the dye can enter inside and get stained. That is why EOSIN NIGROSIN staining, when it's a dead sperm, we'll get a stained pink color, but the viable sperm will not take up any stain.
Yeah. Okay. Okay. Thank you. So I think now the class is very active. Okay. So this is how my classes are. So okay, I think we are done with today's class and we are very clear with our topic also, right?
Yes,
Yes.
thank you, ma'am.
Two tests are very clear: HOS test and sperm vitality test. That is EOSIN and NIGROSIN test.
Yes, ma'am.
So you will never forget this in life.
Yes.
Okay. Thank you.
Thank you, ma'am.
Shweta. Okay. Thank you, everyone.
Thank you, ma'am.
Shweta, can we wind up the class?
Ma'am. Yes, ma'am. Thank you, ma'am.
Thank you so much. Bye.